Today, ladies, we have with us Dr. Anita Haugabrook. Dr. Haugabrook is a graduate of the Morehouse School of Medicine, and she currently works as a hospitalist in Atlanta, Georgia. In 2017, she began dedicating time to do medical missionary work and has since then provided medical care to the underserved populations in Panama, Costa Rica, Haiti, Guyana, and Guatemala. Thank you, Dr. Haugabrook, for talking with us today.
It's my pleasure. Thank you.
You know, of course, everybody, we're in our 5th week now of being quarantined or sheltered in place. And it's on every news station, it's all over social media, it's in every thing that we see and that we do with this COVID-19 coronavirus.
Yeah.
So a lot of people are wondering why all of a sudden we have to shut everything down when this is simply another case of the flu. So why can't we compare this with the flu?
Well, that's a twofold answer. Primarily, so first things first, the flu is very similar to coronavirus in the fact that it is a virus. But the issue with the coronavirus versus the flu is that the flu has been around and we have not only vaccines to help prevent or lower the incidence of the flu, but we also have a viable studied treatment for it. And so with those two things, the flu is not as detrimental or deadly as it once was. So if you compare it to the coronavirus in those, in that aspect, the coronavirus, although the family of coronaviruses have been around for years, this COVID-19 is, they keep calling it a novel virus because it's one we've never seen before. So we have no information, no data, no treatment, no vaccine, and it is highly contagious. So the flu it's about twice, almost 2.5 times more contagious than the flu. And so those are the main reasons you cannot compare this to the flu. They're both viruses and they cause similar symptoms in terms of fever, body aches, and that type thing, but the outcomes and what we have available to treat it are vastly different.
What are the risk factors in terms of getting this coronavirus? What is it that we should be looking out for and that we need to be made aware of?
So in terms of the risk factors, we'll go over the medical ones first. So you keep seeing the signs and the it's funny, they're overhead in Atlanta now with the on the banners for traffic because there's no traffic.
Yeah.
So they're talking about
I
what
saw
to do.
those.
But people that have chronic illnesses are at the highest risk. And so that means things like diabetes, chronic kidney disease, people that are on dialysis, people that have asthma, people that have immune disorders such as lupus and sarcoidosis and those things that on their own suppress the immune system, and they're taking immunosuppressants. So they're highly susceptible to getting infected by COVID-19. Some other lesser thought of things. I think people don't realize the immune suppression that's associated with diabetes. And I'm always, when I have the opportunity, speak on that because people don't view that as an immune, a disease that lowers the immune system, but diabetes is certainly one of those. And then any chronic lung conditions, COPD, emphysema, those are your highest risk. They put the elderly in that category as well, but I really think it's more because as you age, you're going to have something. And so they tend to have one of those chronic diseases.
Okay. That's interesting that you said that because I too would have never looked at diabetes as something that lowers your immune system. I'm just thinking, oh, they don't have enough insulin or they have too much or they have to do that. So that's interesting to know. Now, what are the symptoms that we should be on the lookout for? Because, you know, a lot of the symptoms with from the things that we've seen, headache, you have a cough, you know, you may have body ache. So people may look at those symptoms as, oh, you know what, it's just something else. Allergies are crazy right now, and it's affecting that. So what are some things that we should be paying attention to? And then what are those symptoms that are like, okay, now you need to go to the hospital or you need to call your doctor when it gets to this point?
That's a great question. I'd love to expound on that one. So I think that the primary symptoms that have been continuous across the board, and because the symptoms are changing, I shouldn't say they're changing, how we're seeing patients present is changing.
Okay.
But the thing that remains like the most constant thing is a fever. And I don't mean like, a fever of 100, 100.2. I mean, big fevers, 102.5, 103 fevers, and shortness of breath. So those are the two main things. We've seen patients present with diarrhea-like illnesses with fever, not just the cough and shortness of breath. The body aches and fatigue, they're not your run-of-the-mill, like it's the end of the day kind of fatigue. I mean, people describe this as, I want to lift my head off the bed and I can't. That's how exhausted they feel.
Oh, wow.
So I would encourage people to look at the extremes, because it is allergy season and it's still the tail end of cold and flu season. So it's really the extremes of these, things like fatigue and shortness of breath. I mean, allergies are bad right now. I go outside. If I stay out in the yard too long, I get a little short of breath. But when I get inside, I'm better. So those things, you just kind of have to separate out what's here and what's here to stay, and the severity of it. So again, low grade fevers, probably not much at all. But if you start spiking, pretty big fevers. In terms of when to go get, seek help, I'm going to put it in two parts. I think if you have the persistence of any of the symptoms such as fever, malaise, cough, shortness of breath, I think you should reach out to your provider. Obviously telehealth is wide open right now, and also just phone calls. And as they're boosting up the amount of testing, you can usually get a referral to get a test off site. They don't even have to come to the doctor's office. They'll refer you somewhere, tell you where to get a test done. In terms of when to go to the hospital, it's still not even the fever. I mean, these people are having daily fevers for 7 to 10 days.
Wow.
It's the shortness of breath. And when I say shortness of breath, it feels like people say they feel like, I had a gentleman describe it to me the other day as, I made up my bed and I sat down and felt like I wasn't going to be able to catch my next breath from making up his bed.
Oh, wow. So it's severity of those symptoms. Okay.
Yes.
Okay.
And those are the two things that we're hospitalizing for. I mean, the fevers and stuff, like I said, they're going to be there. You can be at home and be treated at home with a fever. But the primary thing that we're hospitalizing, the primary symptom that we're hospitalizing people for is the shortness of breath that's associated with it, because they typically have the COVID-associated pneumonia, and that's where the bad outcomes are coming from.
Okay. Now, from what I've been hearing, they say that sometimes these symptoms can just come out of nowhere. They hit really quickly, but still we should be paying attention to the severity of it once it does hit us. Is that what you're saying?
That's correct.
Okay. Now, here is where I really want to kind of get into the meat of our conversation. And that is, it seems like Black people, Latinos, people of color, particularly our Black people, are predisposed to many of the diseases that you said were kind of like the things that were risk factors, the high blood pressure, the diabetes, even the asthma. So we're predisposed to these diseases already. And now we are, disproportionately dying from COVID-19. So are these predispositions, is this biological, or is it some environmental factors, social factors there? What causes us to have those high numbers?
So this is going to be my favorite answer, question and answer. And I commend you for observing first that African Americans and people of color have higher incidences of these chronic illnesses. So I was a little bit upset when people were starting to say, oh, this is a racial thing, that more Black people, more Latino people are dying of COVID. It's not that they're dying. They have worse disease because of what's already going on with them. And so, of course, their death rates are going to be higher. I like to break this up into two parts. So, because it really is. So you have lack of access and lack of insight is the way I like to put it, that drive these two factors. So we'll do the lack of insight first, because it's one of my pet peeves in medicine. You learn by what your predecessors did. And so the stoic people of color, African Americans and Latinos and stuff of the past that didn't go to the doctor, instilled that into the next generation and subsequently the next generation. So you have generations of people who don't believe in Western medicine, or they can have symptoms that they know what the symptoms are of things like diabetes and stuff, and they just don't go get it checked. And so then you have something like COVID come along and you have uncontrolled diabetes and you're a statistic now. Right. So the other side of that is the lack of access. And we know that that plays in the socioeconomics, which could be black, white, or whatever, but blacks tend to have that burden too, and Latinos. But from a socioeconomic standpoint, if you do not have access to care, and let me make that real clear, access to good care, because a lot of times they have access to care, but it's not good care. Right. And so they either don't go because they don't trust or the system has failed them, or sometimes they don't even have transportation to go. And so they have these chronic illnesses that are running amok. And then again, when something like COVID comes along, our numbers are disproportionately represented. And so I think one of the things that we have to do, as a generation, is to break that. I don't like to call it generational curses, but a lot of people would be, familiar with that phrase. We have to break it. We have to go take care of ourselves, do our preventive medicine. Those are the things that put us at risk for anything that comes along.
Right. I was reading an article from this article, I think it's from April 10th of 2020, and it's a BuzzFeed article, and it talks about how the coronavirus is disproportionately taking the lives of Black people. And it mentioned everything that you just said. And something else that it talked about as far as some of those social factors is the fact that a lot of Black people tend to, and Latino people tend to work in these jobs that are now essential jobs. And, you can't, it says you can't drive a bus or wash dishes on Zoom. You know what I mean? So they're having to go to work.
Yeah.
And unfortunately, there was a bus driver who was on Zoom. He talked about people getting on the bus and they're coughing on people. And within a couple of weeks, he was dead from the coronavirus, because they're now having to go do these jobs where they're not being protected with the protective gear and things like that. Some other jobs that was mentioned in this article is the fact that a high percentage of the workers who are in frontline healthcare, those MAs, those lab techs, a lot of people who are in home health, senior living, nursing home type health, are people of color. And those
even environmental services.
Exactly. And those are lower paying jobs where people, you mentioned, not being able to go to the doctor, but even not being able to afford, in their minds, the medications that they need if they were to go to the doctor. It's got, do I pay this $30 copay, or do I buy food for
food on the table?
Right. So that's that. It's disheartening, I think, to kind of look at it and see how things just it always goes back to that those social issues and where we stand in terms of finances and as you said, insight, with that mindset of you know what, I got a headache, it's real bad, I'm coughing, I'm gonna go to the store, get some Mucinex, and then I'm going to work.
Yep.
You know what I mean? And now they have,
because I can't afford to take a day off, or I can't, the boss gonna get me if I'm not there. Mama ain't miss a day of work and all of her 30 years of working.
Exactly. I gotta work. So and now you're spreading it around, and I think too, and you tell me your thoughts on this, I think too, a lot of people think that, I'm not scared of catching that stuff. And so they go out about, amongst people and not, with proper masks or things on. And it's not them that they really should be worried about. It's them spreading it to other people.
Right.
So are you seeing cases where, maybe it wasn't that person, but they were catching it from careless people? You know what I mean? That maybe people in their household or.
Yeah, so in those regards, that's the toughest part, is the one of the most common statements people say when I'm, see them in the hospitals, I have no idea where I got this from. So you have, healthcare providers and stuff like that, that we're, obviously at risk, and, we're actually monitoring our temperatures at home twice a day and things like that to try to, be ahead of it. But, the common person really doesn't know who it was.
Right.
And I asked people, but like one gentleman told me that the one thing he did know is he had gone to a nursing home to visit a relative. Not that his relative ever had it, but he went right before they closed down the nursing homes. He went to the nursing home, and he said that in his, opening statement. So he knew in hindsight that was a risk factor, but people really just don't know where they're getting it. I will say that this thing about the asymptomatic carrier, and even the milder symptom carrier, that's why it's running rampant.
Okay.
Right. That's why it's running rampant. I think there are more people that have the disease and are not, sick, obviously sick, than those that are, lying in the hospital beds and, ERs and that type of stuff, honestly.
Something else I read in this article from BuzzFeed I never thought about was the fact that, a lot of times in African American and Latino households, they're multi-generational households.
Yeah.
And so you may have grandmama, mama, children, grandbabies, all living in the house together. And if somebody does get sick, where do you quarantine them at?
Right.
They don't have the room to just quarantine someone in that space. And so if somebody is presenting with symptoms, whether they know what it is or not, there's really nowhere for them to go. So they have all of these, it's just moving from family to families, like we've seen in Albany, where it's taken families.
Very tragic, yeah.
Yeah.
And that is, we're now, of course, this is on the backside or hindsight, but we're now, as we're discharging more patients from the hospital, that's one of those things that we're looking at. Do you have some place that you can quarantine in your own home? And sometimes we're finding out that they don't. And so these, you've heard of, the hotels that the state is kind of garnered to have people to have a comfortable place to go until their quarantine is up, and, that type thing. But I will say that the quarantine period, I know this probably shouldn't sound right, but the quarantine period, if you get COVID-19, is so much shorter than if you're just like somebody that was exposed, or, if you have like the exposure or contact with somebody and you have the 14-day quarantine. So if you actually get COVID, the quarantine, I mean, you're able to come out of quarantine after you've not had a fever for 72 hours.
Oh, really?
Right. No fever for 72 hours or 7 days after your first symptom.
Is that because you're no longer contagious?
Right. Because of the amount of virus and your immunity that comes with it.
Okay.
Those are the criteria. So when we discharge people, if they've been in the hospital and hadn't had a fever for 3 days, or, they came in on day 5 of symptoms and stayed for 2 days, they're good.
Okay, so that's why you see their family able to hug them immediately. I wondered that. I was like, well, how are they able to just like go up to people? Aren't they going to get it? That makes sense. That does make a lot of sense. Well, let me ask you this, Dr. Haugabrook. What tips would you give African American women in order to avoid this virus? What can we do to protect ourselves?
Sure. So the guidelines that are put out, and they're ever changing, but they're very well thought out. And so the first thing is knowledge, right? Get a reputable source. I would say the CDC.gov, not what somebody said the CDC said, but go to the CDC.gov yourself and look at these guidelines.
You mean we can't go by? My cousin worked at friend worked at the CDC.
It's a website that's open to everybody, and they have and literally they have, when you look at things like that, they have like when it says patient information, it is anybody could understand it. It's not talking in terms of numbers and like all that stuff. It's really at a level that anybody that can read can understand what the guidelines are. And so those guidelines are important. I think the other thing is that if you're doing it, but you're not instilling it in those in your community, then I think it's an injustice to do so, right? So you can't let your good, your good girlfriend say, "It don't bother me. I ain't gonna be around the old people." Talk to them, tell them, no. use your knowledge to inform others and implore them to be as educated or as studied as you are about the topic.
Yeah.
The other thing is, outside of following the guidelines with the hand washing and that type of stuff, is I think some people are forgetting, like we were talking about this not long ago, when people were all in arms and they were saying, the kids shouldn't have play dates either. That's very real. Very real. So it's not just you, it's those who are in your, as we call it, quarantine bubble, that you have to make sure they're doing the same things, right? The kids have to stay away from other kids. I mean, they can play within their, their household,
Absolutely.
but it doesn't do any good to go, your neighbor's child may have played with the other neighbor that's a healthcare worker's child.
Yeah.
The healthcare worker's an asymptomatic carrier. The other kid is, but when your kid gets it,
Yeah.
And so it's really that kind of making your whole, like your whole environment, safe. And then of course, doing things like making sure that you are doing the best for your immunity. And so interestingly enough, one of the protocols that we use at one of the hospitals that I work at, there's a medication, which I'm not going to name because I don't want to push any medications, but it's a prescription medication that we give them when they're hospitalized. And then we subsequently give them a cocktail of zinc, 220 milligrams of zinc, 1,500 milligrams of vitamin C, 100 milligrams of thiamine. So these are just stuff you can get over the counter.
Absolutely.
that are natural, that are immune boosters, and we put that with this medication, and preliminary studies are showing that we're reducing the progression of the disease. It doesn't make COVID go away, but we're not seeing as many people go from a hospital bed to the ICU and on the ventilator and stuff if we're instilling that early enough. So you could take those daily.
And I was just going to ask you that. Is that something that we should start focusing on taking it? Is it preventive? I know it boosts your immune system.
And that's
Does
how
it help to?
Yeah, it doesn't, because it doesn't kill the virus. You're mostly revving up the immune system to fight it off.
Okay.
So if you can fight it off before you actually get it, then it makes sense that you do that.
Absolutely.
Because then if you come in contact with a carrier, if your immune system is in hyper overdrive, then you're less likely to become infected by those virus particles.
Oh, awesome. Thank you for that bit of information. So what else can we do? We talked about those pre-existing conditions. We talked about diabetes, high blood pressure, being in a position to where we're picking and choosing, feed the kids, buy our medication, or what have you. What are some other things that you can advise us to in order to stay healthy as African-American women?
I think the biggest thing is, I mentioned it, kind of alluded to it earlier, that if you are taking care of yourself in all aspects, your physical, spiritual, just your all over well-being, paying attention to symptoms and signs. One of the things that I think people fail to realize is that some of these disease processes are just risk factors in and of themselves. But it's like I tell people, like with diabetes, controlled diabetes is vastly different than uncontrolled diabetes. So you can be a diabetic, but if you manage your diabetes and keep your blood sugars at a normal level, you don't predispose yourself to all the end stage stuff like dialysis and heart disease and all that type of stuff. It's the uncontrolled disease process.
Gotcha.
So if you have hypertension, acknowledge it, right? Monitor your blood pressure and take your medication, or do the things that the doctor says: lower your salt, get some exercise, and you may not have to take medication, but don't just act like it doesn't exist, because that's where the trouble comes in.
Yeah, I think we have too many in our communities who ignore it, thinking if I ignore it, it'll go away. Yeah. Kind of goes back to what you were saying earlier, that stoic wall that we put up. We're like, oh yeah, I'm not going to go to a doctor. I'm good. I feel okay. So I'm good. Yeah. Well, Dr. Haugabrook, I really appreciate you giving us this time to talk to you. Is there anything else you want us to know about this COVID-19 coronavirus?
I think my parting tip would be to stay informed Again, I'm going to say it, reliable sources, stay informed. Do not get overwhelmed by the information that's out there. Pick a source, stick with your source, and continue to live life, right? This too shall pass. It will. We can be a part of the solution or a part of the problem.
Yeah.
And being a part of the solution means that you stay informed, you do what's being asked of you, and we'll be okay.
I love that. Thank you so much.
Sure.